Previously, we discussed epilepsy and its definition. We also discussed the different types of epilepsy and their simple presentation that anyone in the community can look out for, because this knowledge is for a person who is in the community. So today, we are discussing the stages of a convulsion or a seizure. Welcome, Life with Nurse Carol. Let me take you through this first. As we discussed earlier, if you missed the first video, I can attach it in the description. But we say that there are two major types of seizures. However, these seizures present very differently. So even the stages that we are discussing here may not apply for the different types of seizures, because some of them are brief, while some of them are prolonged. So the first stage of an epilepsy seizure is what we call the prodromal stage. This comes hours to days before the seizure appears, and for someone who has had these seizures for some time, especially if they are adults, they are able to sense. They get warning signs, and they are able to know that there is something that is pending, that maybe I'm about to have my seizure in hours or in days. And this can present in form of depression. They can present in form of sleeping changes, urinary changes, changes in concentration. All of a sudden you feel anxious, you can concentrate on something, you're up and down, you can experience mood swings, you can experience anxiety. They could be gastroenterology symptoms like diarrhea, vomiting, and in short, people describe this as a pending sense of doom. They know that it's coming, so most of them start getting ready that probably if I've missed my medication, I need to take my medication. However, some of them get to know and they start taking precautions. For example, if I was supposed to drive to work tomorrow, I may have to stay home or ask someone for a lift or get a driver to drive me wherever I'll go. So these are warning signs. The second stage that we have is the aura stage, and here you don't have hours to days. It's literally telling you that I'm getting closer. If I've been in the prodromal stage, I had some minutes, some hours. So for people who are adults and have experienced this before, they start looking out for a safe environment. The seizure can strike. So some of the signs and symptoms that they experience is altered vision or hearing. All of a sudden, the space appears blank or it appears black. Some people have reported a sharp noise that comes that no one else has heard. Some people feel dizzy and they can know that it is very near, it's seconds away. Some people get anxious and maybe a few minutes and then you settle somewhere safe. Whereas some people, they start smelling something that no one else is smelling. And if you've been experienced enough, if you've had several seizures and you're an adult, you know that it is near and you need to take safety. Some people, it takes them unaware, so they're just unable to speak and they're all of a sudden they just get mute. So whatever you're doing, if you've had a seizure, if you have someone that you're taking care of, you need to ask them, do they get repeated signs before the seizure? Because the aura stage literally telling you that it's in seconds to minutes. You don't have much time. So the best you can do to that person, if they tell you it's coming, take them to a very safe environment. Next, we have the ictus stage. The ictus stage is the seizure stage. It's the active stage of the seizure. It's literally happening. There is nothing you can do. If you're the patient, you're already down or you're already having the symptoms. So usually this lasts 1 to 3 minutes. However, if it lasts more than 5 minutes, this is an emergency. Don't sit back and say, you know, it is over, it lasted some time, but you need to take this person to a hospital setting immediately. Don't sit back. The wires are not okay. You need to take that person to be managed in a hospital setting. The next stage is the post-ictal stage. Literally, that's after the seizure. This may present differently with everyone. After the seizure, some people are aware of what has been happening. However, some people may not be aware. It takes different time to days for people to recover. Some people may recover in seconds. Some people may recover in minutes to hours. Some people, it takes them some time to recover. So give them time to recover. Don't push this person. Tell me what is happening. You're scaring me. No, it takes them time to recover. And most times after the seizure, they are confused. They don't know what exactly is happening or what has happened. Sometimes they've forgotten. They've forgotten what they were actually doing, what they were thinking about. And it's sad that if you keep pushing them, you make them to feel guilty of what has been happening. So don't over push. Some of them have forgotten what has been happening. This thing actually affects their memory. Epilepsy affects memory. Long term, short term, you find that things that were obvious to them, they start forgetting, from birthdays to days of the week to normal things like this is my name. In a long term, they get affected. After seizures, for example, people who have experienced tonic-clonic seizures, they bite their tongues. So you need to ask, you need to check them out. Have they bitten their tongue? Is there anything more that you can do to help them to get care for the wounds they've attained? It's said that some people have not yet recognized their warning signs in the oral stage, that even when they feel those signs, they haven't known that they're warning to the seizure. So they remain around dangerous objects. So some of them fall into fires, some of them fall on sharp objects. But the moment you realize that this person has fallen into that place, don't leave them there. Don't fear that this person is going to transfer the epilepsy on you. Epilepsy is not contagious. I've said that over and over. Please don't leave someone to suffer. Don't leave someone to get an accident that they will have to live with for the rest of their life because you fear epilepsy is contagious. It is not. So help them at whatever point in time that you get in contact with them. They will present with body aches, especially with the stiffening and the jerking. By the time the seizure is done, that part of the body is paining. They have headaches. They have general body weakness. Don't push through. Just help them to adapt to what is happening and to what has happened. Help them understand what has been taking place and show them most support, because that's what they need.